Hello everyone. It's another day. I hope that you had a blessed service and mine was good too. So welcome to today's discussion whereby we are going to discuss on a condition known as gastritis. Gastritis is an inflammation of the gastric mucosa, and we have two types, or it can be classified into two types. There is what we call acute gastritis and chronic gastritis. Today, I want us to look at the acute gastritis, which is also known as erosive or hemorrhagic type. Now, what are the causes of acute gastritis? Okay, the first cause is drugs. Remember, we have talked about drugs for a while in our previous topics. So, drugs such as NSAIDs can cause acute gastritis or can cause inflammation in the gastric mucosa. The other one is excessive alcohol intake. These are the things that we have been talking about, and these are the things that I've been saying that we can control or we can avoid as human beings in order to avoid some conditions. So excessive alcohol intake can cause, it's another cause of acute gastritis. Another cause is chemical irritants, like in the case of organophosphate poisoning. So that can also come up with acute gastritis or inflammation of the gastric mucosa. Another cause is unsuitable diets. Remember, we have also talked about diet for a long time since we started the discussion. So, when we talk of diet, spicy diets can cause acute gastritis or what we call food poisoning. So, diet is another risk factor too, or is another cause of acute gastritis. So, that's why I've always insisted that you check on the diet that you are taking every day. Another cause is H. pylori infection. We have also talked about H. pylori, so it's another cause of acute gastritis. And the other cause is stress. It can be due to other health conditions. It can also be due to other or due to burns, tumors, and all that. So stress can also cause acute gastritis. Another one is acute viral infection, like in the case of HIV/AIDS, in the case of cytomegalovirus. So, acute viral infection can also cause gastritis. Another cause is what we call uremia or excess urea in the blood. So, those are the causes of acute gastritis. Now, let us look at the clinical features. What are the clinical features of acute gastritis? In some cases, you will find that they are asymptomatic in the first stage. So in the first stage, you might realize that they are asymptomatic. The patient has no signs or symptoms. The other one is what we call anorexia or lack of appetite. Another clinical presentation is the epigastric pain. You feel some pain in your epigastric region. Another sign is what we call nausea. That feeling that it's like you want to vomit every now and then. That's what we call nausea. Another clinical feature or clinical presentation is the epigastric tenderness. Remember, when doing the palpation or when the doctor will be doing the examination, he'll do what we call palpation. And while palpating in the upper region or in the epigastric region, you'll find some tenderness. The area will be tender. So that's another clinical feature. We also have vomiting. You can present with vomiting, or gastritis can present with vomiting. It can also come up with, or another presentation is what we call melena stool. I remember we talked about that. That's when you go for a long call, you find that your stool is somehow dark due to some bleeding. So you can also present with melena stool. Another presentation which is common is the belching. You also experience belching. All will present with belching. You can also present with hematemesis. Remember, we said hematemesis is vomiting of blood. So those are the clinical features of acute gastritis. And up to this far, I am sure you have learned something. So let us meet the next video, whereby we'll be talking about the investigations, or what are some of the investigations that you are supposed to do when suspected to be having acute gastritis. So we'll talk about the investigations and also treatment of acute gastritis. So thank you for watching. Continue subscribing, liking, sharing, and commenting my videos. Let's meet in the next discussion. Have a blessed day. Thank you for watching.